This episode of the Seniors Flourish podcast is brought to you by the Learning Lab membership, because I get it. I was working with older adults in home health when I started out, and I was the only OT practitioner. I was new, I had no mentorship, I struggled with the little things at work, and I was so incredibly overwhelmed. I was struggling to keep up with that paperwork, and because I was working such ridiculously long hours, trying to research best practice, find all the patient handouts I needed, I just couldn't keep up with it all. And the worst part is I was constantly doubting myself. Am I really doing what's best for my new patients? That's why I created the Learning Lab, because I desperately needed a way to get organized and have everything I needed at my fingertips. So it's cheaper than a textbook, but it has hundreds of treatment idea videos, patient handouts, evidence-based resources, and more right at your fingertips when you need it. So join today at seniorsflourish.com/Learning Lab.
Welcome to the Seniors Flourish podcast, where it's all about helping occupational therapy practitioners disrupt the norm by throwing away the rainbow art and being the best you can be when working with older adults.
Let's sound serious. Oh, I'm sorry. Did you start yet?
That's okay. I'm very serious. Welcome everyone to the Seniors Flourish podcast. My name is Mandy Chamberlain. I'm an occupational therapist, and I talk about everything occupational therapy and specifically working with the older adult. And today we are talking about occupational therapy and arthritis. So going to talk a little bit about explain what it is, some treatment, some interventions, talk about the subject of arthritis. And my guest today is Hoang Tran. She is an occupational therapist and a hand therapist. And welcome to the show.
Thank you so much, Mandy, for inviting me on here. And I love that you just sang like that one part, because I always do a little singing too, but I can't carry a tune to save my life.
I can't sing either. I don't know. Sometimes my soul just wants to sing.
I love
and I'm
it.
trying to keep it on the down low on the podcast.
That's okay.
I crack it out once in a while. Well, thank you. Thank you so much for joining me. So usually when I start the show, we talk, the guest talks a little bit about their OT journey, kind of how they found OT and kind of what they're doing today. So why don't we just start there?
Wow, sure. I mean, how far back do you want to go?
Well, you know what?
No. I have been a therapist for almost 20 years. I got into occupational therapy because I thought I wanted to work with kids. And it turned out after going through some of my earlier college days, I decided that adults and adult hands were the area that I wanted to do. So after college, I, like most new grads, went out and got jobs in whatever area that I could. And since I knew I wanted to work with adults, I worked in inpatient rehab, I worked in skilled nursing, and then I did many years in acute care. Then from acute care, hospital-based therapy, I moved into outpatient therapy, and really specifically outpatient hands and upper extremity therapy. And about 5 years ago, I decided to go out on my own, open up my own therapy practice in Miami, Florida, called Hands-On Therapy Services. And this is where I currently am now.
Cool. I wish I could grow up to be like you, have your own.
It's hard. I don't know. People say they do, but I'm like, do you really? Do you really?
Do you really want to?
Do you really? Because, but that's, so we have, we're growing constantly. We added another occupational therapist. So one of my main goals of having my own practice, like I always tell the therapists that, that come and work here, or people who come and volunteer, is that, our mission is to help people live more active, pain-free lives. But that's the mission of the company. But the vision of the company is essentially to grow and to support other therapists so that we can fulfill that mission. So if we have a vision of growing a type of facility that supports and grows other therapists to specialize in the areas that they want to, then, we just have happier therapists, more fulfilled therapists that can then go out and help more and more people.
Awesome. That's amazing. That also kind of gives such a neat direction for a business as well, instead of just providing to the patients, which obviously is important, right?
But yeah, I think it's about, if we could help the therapists, fulfill their desires and what they want to work in, they could just do that so much better. Like, I'm only one person. I can't do it all, so I actually started a CHT fellowship in my clinic, and I brought in a therapist, just started with me about like a month or 2 months ago. And she is getting ready to study. She's studying to take the CHT.
Oh,
and,
wow.
So we're very excited to be able to support her here, and we take volunteers and stuff like that and show them how great, not just OT, but, hand therapy, and not just hands, but like we help people with arm problems, like shoulder, elbow, wrist, hand, neck, so it's all, it's not just hands.
Yeah, right. Yeah, I know. It's when they say hand therapy, I mean, obviously us that are in it, I mean, you, as a hand therapist, you're like, I'm not just a hand therapist, I'm sure.
Yeah. But a lot of people don't know it. So, in my, my business service proposition, I say hands and arms, so that people understand that we do a little bit more. And there are some certified hand therapists that just do hands and wrists. They don't really do elbows and shoulders for whatever reason, their decisions or where they work. But we are, we're a holistic type of company. So yes, we actually treat the whole body, but we definitely specialize in arms and hands.
Very cool. Well, today we're going to be talking about arthritis. Dun, dun, dun. So we're talking arthritis. I know. Doesn't everyone love arthritis? That's why I had you on the show. Because people have a lot of. It's hard. It's hard. A lot of people have it. Yeah. So let's just start with defining, what is a definition of arthritis, and maybe just talk a little bit about maybe some of the most common types.
Okay. So there's hundreds of forms of arthritis, what they consider arthritis, but two of the main forms that you're going to see is osteoarthritis and rheumatoid arthritis. And osteoarthritis is a type of degenerative change of the joint type of arthritis that's a result of wear and tear. Okay, so most common areas that you're going to see it's in the hips, knees, shoulders, like your big joints, right? And then you're going to see it in your small joints, like your thumbs, your fingers, and your spine, those small ones. And no matter where your osteoarthritis is, because of those degenerative changes, it really can affect, all areas of your life. I can go a little bit more into that in a little bit. And then the other really big one is rheumatoid arthritis. And there's several different types of, RA is a type of autoimmune type of arthritis. It's a disease process or disorder process where the body just attacks itself specifically at that joint level. And it's an inflammatory process, and the joint changes as a result of all that inflammation and how the body attacks itself. And it actually has a very particular pattern of deformity. Like you'll usually see the hands behave in a certain way, the wrists behave in the way, the shoulders and elbows. It has a very particular pattern of deformity. Unfortunately, it's a very debilitating disorder. And some of the other ones are gout, lupus, juvenile idiopathic arthritis. I actually have someone who's coming in tomorrow that we're going to see. She's a young girl the family says that she has rheumatoid arthritis, but I'm kind of wondering if it's some type of juvenile arthritis. She's pretty young. So I'm really.
Does that present differently?
It does in kids, but apparently she already has some patterns of deformity. So I'm really kind of curious to talk to them first to make sure she is somebody who we could help. But she was referred to me by another certified hand therapist in the local area. that wasn't able to help her. So she got referred to me. So we're going to, meet her. We're going to talk to her, and we're just going to see what type of treatment mechanisms, like what kind of treatments that we can provide for her. So,
wow. Yeah. That's the thing. Like, obviously, most of my experience with arthritis is because I've worked in outpatient, I've worked in skilled nursing and home health and things like that and I would say in general, I am not seeing a patient just for arthritis.
Right.
Do you know what I mean?
Absolutely.
And so and those are the things that I think are really tricky for a lot of maybe us generalists because, you may see some like joint deformity, or maybe they'll be complaining about, oh, I can't do X, Y, and Z or this, ADL because of my, osteoarthritis or whatever. And you're not seeing them specifically for that, but that's something that needs to be addressed. Sure. And so, it's kind of, I find it sometimes one of those kind of randomly challenging because sometimes you're seeing them for something completely different and it's almost like the overhanging, it's like the big problem. And then you're like, but this is definitely a contributing factor.
Yes, absolutely.
So let's maybe talk a little bit about maybe like preventative techniques, or if you have a patient that is starting to have some joint deformity, or, we like to always talk about like joint protection and that kind of thing. So what is your take on that, since you probably see it specifically a little bit more often?
Yeah. So from an outpatient perspective, they always come in and they're specifically coming for that, right? But I used to work in acute care for a long time. And in acute care or in skilled nursing, they're there for other things, but one of the reasons why they're maybe in skilled nursing is because they can't take care of themselves. So if you could just help them do something a little bit better by helping them to move their joints or anything like that, then they would be able to like get dressed or, make meals and to take care of themselves better, right? So I think that one of the biggest things, and I think one of the most effective things that we could do to help them be more independent is instead of looking just at like, oh, you have arthritis and you have a deformity at that joint, well, first of all, what's limiting you, right? So what's limiting you? Do you have pain? So if they have pain, then you can treat them for some of that pain that they have. Now, the expectation isn't like, oh, the pain is going to go away just because you do like one treatment or something. But what can I do to help you so you have a little bit less pain when you go and do your buttons, right? Or when you go and open a jar. So the most effective thing that you could do is just meet your patients where they're at, learn as much as you can about what is it that they need to do in their lifestyle? What do they like? What, not just like the necessities, but what would they like to be able to do? And then from there, you can educate them on what's possible and what your goals would look like. So for example, I have somebody who I'm working with that has like what we talked about, these junky shoulders. She has bilateral shoulder arthritis. One of them, and she has it, she's older, she's in her 70s. And her history is already telling us that she's got bad arthritis. She had bilateral total knee replacements. And now that it's time for the shoulders, she's like, I've had enough. I don't want to do anymore. And, unfortunately, like, depending on the setting, not everyone knows for sure what they have. I was able to get her to bring her MRI so she can tell me, so I can have an expectation, are the torns intact? Are the tendons intact? Are they torn? What's going on? I'm not changing her arthritis. Like, there's nothing that I'm going to do just can change how bad her arthritis is. And so that education has to be there too. Like, I'm going to help you a certain amount so that you can be functional, so you can move a little bit with a better ease, and be able to get dressed and wash your hair without being in such pain. One of the biggest things is you can't sleep, right? Because it's so painful. But, meeting her where she's at, like, she doesn't want to have another surgery. What does she want to do? What can we do to help her reduce some of that pain? So arthritis is a change in that joint. And it's not necessarily the joint that hurts, but all the muscles around that joint that is painful. So now what can we do to help her reduce some of that pain? Teach her how to move. That's a little bit easier for her. That's a little bit better. Like, people don't always have awareness of how they're moving. So maybe they're making those bones rub together more than they need to. So there's different techniques where you teach them to do a little bit more pendulum instead of reaching overhead. Like if you're getting dressed or getting your bra on, or washing or anything like that, you can have them do a little bit more pendulum, bend at their waist so their arm hangs, so they don't have to reach so high, right? And then you can teach them how to lift better so they have less pain. But then there's different exercises that you could teach them so they can just improve their overall range of motion. Sometimes people are very painful because they lack the motion. And then they're more painful too because they lack strength in specific areas. Is that helpful? I don't know if I'm going on and on. I'm like,
no, I think, it's kind of like a good place to start. I mean, like I was saying, like it's one of those tricky things because it can be so limiting. And I think just from, coworkers and things like that, people are just like, I'm not sure like how much, is giving someone who has a really, like, you have those shoulders and they're like squeak and they're just, exactly what I'm talking about.
She has that. Like, she has severe crepitus. So when she moves, it's like clunk. It's like crushing cans of metal in there. It's like terrible. But, the pain, it's not the pain. The sound is worse than it actually is painful, right? So when it comes to shoulders, what can she do to have less of those sounds? There's a lot of scapular things that we need to do to help them. Their shoulder blade is like completely stuck to their ribs and nothing is moving. So what can we do? Well, we can move one part, but if we don't move the other part, it's not necessarily helping them, right? So we're moving their arm up and down, but we're not doing anything to their shoulder blade or collarbone, then we're not as effective as we could be if we were to go and put them, like, for example, in side lying and do a little scapular mobilization to get those to get that particular bone and those muscles moving a little bit better. Now, obviously, that takes a little bit more skill.
Right.
And like I said, you don't have to be super technical. But if you had someone in side lying and you assisted them in doing scapular elevation, depression, retraction, protraction, those are just very simple movements of the shoulder blade. It's very hard to do when you're just sitting up. So sometimes if you're like, let's say, for example, working with someone in a skilled nursing facility or inpatient rehab, these are some things that you could do if you're working on bed mobility, right? You're getting them up for the morning, you're helping them in for their afternoon nap or something. You take these opportunities when they're about to go into bed and you can talk to them about, oh, well, how can you, let me help you just loosen up your shoulder a little bit. Let me help you move your shoulder blades a little bit. And then what I can do is show you how you could lay down so you're more comfortable. So then that becomes into, it's not necessarily joint protection, but it's modification, right? So that they, positioning so that they could be more comfortable and they could sleep better. Like, listen, if you help just one person sleep better, like, dude, you totally made my day. Like, they come in and they're like, listen, if you don't get sleep, how do you behave? You're grouchy, you're grumpy. So when you help your patients, like, just feel more comfortable, sleep better, I mean, you've just totally improved their day. That's just one improvement that is so key.
Well, and that's, and that's just kind of piggybacking on piggybacking.
Yes, can you put something in my piggy bank, please?
is like even making sure that you're asking about sleep during your evaluation. And I always kind of talk about evaluation, some of the things I think people miss, and that is definitely one of them is sleep. And obviously, like I said, pain and that kind of thing. What are some things? Okay, so you talked about maybe just some positioning, range of motion for pain control. What are some other things that work well with people who have arthritis or that type of pain?
That's a shoulder one. You know what that I see quite often are CMC arthritis. Right?
Yes.
Do you see that? Do you see that?
Yes.
CMC.
Yes.
Carpal,
and I don't even work in hands, and that is a common one.
Carpal, joint arthritis. And let me tell you, more ladies have it than men. So ladies, you got to watch and take care of your hands because, out of my 20 years, I've seen pretty much all women. I saw one man, he had bilateral CMC arthritis. And he used to come in and every year or two, he would have us remake his splint. So when it comes to the hands, that's where you're going to really see some of these joint protection techniques where you're using wide grip, tools, like let's say your can opener or knives that have like a nice big handle, knives that have a nice size handle but also cut really well, right? You have to have a sharp knife, dude. When you have a dull knife, like your hand works like 100 times worse.
Do you know what's funny that you say that is because actually if you get the silverware that actually have that on there, not like ones where you're slipping like a wide handle on a knife, but the ones that come
with the handle
are terrible.
Oh, yeah.
I think
those
they might have like a little rocker or something, but I'm like, where's the like real knife?
Yeah. Sometimes these fancy modern looking things, they're really terrible for your hands because they're so skinny looking. But your thumb does 50% of the work of your hand. So we've got to really protect the thumbs ahead of time. So I do a lot of education and I try to catch people before they get worse. I have somebody who she's in her, I want to say she's in her early 50s. She's already got CMC arthritis, one thumb worse than the other thumb. She's already been going somewhere. And so she came to me kind of already knowing some of the joint protection techniques because she's seen other therapists and other hand therapists before, and they've made her custom fitted splints, and then she didn't like them. They didn't fit well. And then she ended up ordering some online. There's some great ones online that can fit really well. Those didn't fit her very well either. And it's because when you have the arthritic changes already, it's very hard to find the over-the-counter ones to fit you well. And there's different patterns of CMC arthritis type of splints, right? So I make one particular that tends to be small, and I tend to use a certain type of material that is very low, light weight and stuff like that. So we were able to make her one. And the biggest thing about splints is they've just got to fit. Like if they don't fit your splints, if you're going to prescribe them to your patients or anything like that, they should fit like a nice pair of jeans or a nice t-shirt. Like you want to be comfortable, okay, let's put it like this, since most women have it. You should have your splint fit like a nice bra. Okay. If you are fighting your straps all day long, making sure that that's fitting and it's not, falling off and you're having to adjust all the time. That's the way you want your splint to fit. So you're not fighting with it. Because if you're fighting with it, you're not going to want to wear it. It's not, you're just not. And then you expose your thumb to a lot more wear and tear. And then the pain just gets worse. And then eventually you go to the doctor and they say, oh, let me give you injection. Let me give you pills. Oh, that doesn't work. Let me just go ahead and do the surgery.
So what kind of like wear schedule? I mean, like I'm assuming like you'd have typically if you're a CMC joint arthritis as an example, you just have them wear it during the day when they're doing activity, right? Or how do you prescribe that?
You prescribe it based on their activity level, and you prescribe it on when they have pain. So if someone comes to you and they're really inflamed and they have a lot of pain, they would wear it all the time, right? Wear it all the time until your pain reduces, and you obviously take it off to do your exercises or you do your light ADLs, but for the most part, wear it so that you can reduce inflammation, reduce your pain. Once somebody doesn't have like that kind of pain, like for example, my lady, she doesn't have a lot of pain like that, but it does bother her after a while, you would want to advise them to wear it when it most hurts them or with whatever activity most hurts them. So she's a pretty active person. She's like, it hurts me when I go and work out at the gym or when I do yoga and I do certain positions. So you would advise her on using that when she's doing heavier work, but she doesn't have to use it when she's doing lighter work, or you would advise to use it when you're doing repetitive work. Because anything that's going to irritate it and make the pain come, then once that pain gets there, it's hard to break. So if you come in and you have like a little bit of pain here and there, let's get rid of some of that pain, strengthen where we can strengthen, stretch where we can stretch, so that you have the best possible use of your thumb without pain and without restrictions. And then wear that splint to protect it during when you're doing heavy stuff, but not all the time. You don't want to wear stuff all the time unless your arthritis is so bad that you need to have surgery, you're just delaying it. And because you have pain all the time, then you're going to wear the splint all the time. But the whole point of wearing the splint is to essentially reduce your pain a certain amount so you don't have to wear it all the time. You'd only wear it when you are most active or most like doing heavier things. And that's usually my recommendation for a wear schedule.
For a wear schedule. What about those patients that, let's say you're in, I don't know, skilled nursing, and they have like a huge like ulnar drift, or you see them and it's way advanced. Do you, and let's say in general they're not having any pain. I mean, is that something that we should be addressing? Is it something, I think people just like, where do you start with something?
If they don't have, listen, if they don't have any pain and they don't have any limitations from their deformities, like you don't do anything. They have other things you can focus on. So some people, not everyone who has arthritis has pain. So lucky them, right? Lucky them, because most people who have certain amount of arthritis have pain. And there's a small percentage of people, I think, that have these like major deformities. You're like, dang, your thumb shouldn't be in your hand like that.
I know.
But if they don't have any pain and you start pulling on them, they might have pain now.
So well, that's really funny because I've had someone recently, because I currently just work PRN in skilled nursing, and there was a lady, and that was the referral because it was like somebody saw advanced. Yeah, somebody saw oh my God, her hands. And we were like kind of freaking out, like how is she even functioning? And she's been dealing with it for so long that she's adapted through the years. And I just ended up adapting a bunch of things, but everybody, she was just like, well, I don't know. I had these splints that someone gave me like 5 years ago, 5 years ago that I just keep bringing with me to the nursing home, but I haven't really been using. So I'm like, my advice was like, well, I mean, you're doing everything you need to do, but everybody's always worried about like, it's going to get worse. Oh, and so you're like, well, I don't know. I don't know.
People just want it to look like quote unquote normal, right? But if the patient doesn't have any pain and the patient doesn't have any limitations in what she does, because if she's in a skilled nursing facility, let's say she might not necessarily have to open a new jar of salsa, okay? But we do. Right. We eat some chips and salsa in our lives, right? And we need to be able to crank that bottle open. But she doesn't, because she's in a skilled nursing facility and she doesn't have to ever open anything new. She just, all she has to do is worry about getting dressed, eating her food, doing light stuff, playing cards, reading a book, light things. And if that's all she needs her hands for, then good for her that she doesn't have any pain and we don't need to be messing around. I'm sure she has a shoulder we could stretch, but not her thumb.
You know what?
You know what I'm talking about, right?
I had a lot of things to acknowledge.
You have other things. You have other shit to do. You don't need to be messing with her thumbs.
I know. I had some remote controls to adapt. I mean, come on.
Man, it's important to get to your channels and shows. But we don't need to mess with things that don't need to be messed with. I'm a big fan of where are they at? Where are your patients at? And how do we help them? So if she doesn't have a problem, that doctor shouldn't have a problem.
Right. Well, you know how that goes.
You tell
so
them,
what
Mandy.
other things?
You tell them. She doesn't need anything.
Well, I have let's just say I have a very strong, I'm a huge advocate.
Yes, I can believe that.
I'm very nice, but I'm very stern. What other things do you find are most effective for like pain control? Like maybe physical agent modalities or, like you're saying, splinting, positioning. Is there anything else like maybe from if someone had like hand arthritis as an example?
I love the paraffin for hand arthritis. Hand, wrist, get yourself, to Bed Bath & Beyond, order that $30 thing and, come with your 20% off coupon. Okay. So
deal.
When people have arthritis, I do like to recommend moist heat. So paraffin is a type of moist heat. If they cannot buy themselves a paraffin or you don't have one at your facility or anything like that, then I recommend like a warm towel that you wet and you can, and it's always you have to be real careful with this, right? So it's a warm towel, you get it wet or you're most like damp, and then you microwave it. You got to shake it out so that you don't have spot hotness that can burn you. So you just have to like shake it out and then fold it up, and then you could wrap your hands around that. Anything like when you fill up a sink full of warm water, and you can heat it up that way. Jacuzzi, anything like that. I'm a big fan of moist heat when it comes to arthritis and when it comes to stiff arthritis. If you have a type of inflammatory arthritis, then heat is not necessarily the best thing to put it on. Like if you have gout or something like that, or if you have RA and you're in the inflammatory process, that joint's gonna be red, it's gonna be fiery hot, it's gonna be swollen, and heat is not going to be helpful. But most people, if they have osteoarthritis and they just have a lot of stiffness and their pain is due to some of that stiffness, some of those imbalances, then for sure, moist heat. I'm not a big fan of ultrasound. I'm not a big fan of how do you call it? Electrical stim for that, but to each his own. Some people find it very helpful, or, they like to use it. My biggest thing is just know why you're using it. Yeah. Right.
For all of it.
But I like to use Kinesio taping. If people have diffuse swelling, then I'll, recommend an edema glove or anything. But most of the time, people have these arthritic changes, those nodules in their knuckles slowly over time. And there's a ton of people who have them and have no pain. And there are some people who have it and they have pain. And I can tell you one of the top reasons why people have pain is because they're tight somewhere. You just have to find out where they're tight, help massage and stretch them out. Sometimes it's a muscle thing. We have a lot of little itty bitty muscles in our hands. Stretch them out a little, massage them, give them a little love, if you have arthritis on one hand and you massage your other hand with it, then the hand that was massaging hurts. So if you have like a little person and they have like arthritis and their hand hurts, just give them a little love, massage their hands a little bit.
Well, that's even the thing, just like with shoulders, like people, it's that whole cycle. Like they have arthritis in your shoulder, then they don't use their shoulder, and then everything gets tight. Their lats get tight, their pecs get tight, their scapula gets tight. I'm sure that's all you do. But like, I think sometimes you have to kind of look at, we have to look at them holistically, even when we're looking at it from a biomechanical standpoint, and really kind of dig into like what's contributing to that. And sometimes, honestly, just like you said, it strictly is like tightness in the surrounding structures, and you loosen that up, everything feels better. And that's not even actually the quote problem. Like it's not even the original problem. But those darn pecs too, and scapulas, pecs,
I know,
major, minor, they're like,
you can find that minor.
Terrible.
If you can find that pecs minor, you're golden. Yeah, you're golden. Yeah. It's that pecs minor. Kill you every time.
Little stinkers. They're sneaky. So you were talking about Kinesio Tape. I'm also a huge fan of Kinesio Tape. I know, I love it too. There's so many ways you can use it. That's a whole nother topic.
And leave it for 5 days.
I know. It just helps with that edema. It really can be magical if you learn how to put it on appropriately.
I love it.
that kind of thing. Hey, do you ever address, and I know this isn't necessarily like hand therapy specific, but kind of more, since you talk about trying to be a little bit more holistic in your practice, addressing some of the emotional effects of arthritis, like you're talking about like sleep disturbances, pain, depression due to pain, sleep disturbances, or how is that addressed or referred? I love it.
It's so part of OT. It's so part of OT. Yeah. And am I okay recommending to drink, to have some wine, to just relax, have this glass of wine. It will help you to go to sleep. No, if you look at that person and you're genuine in helping them, I think that emotional aspect of helping them with any of their arthritis or with any of their pain and sleep disturbances, and will automatically kind of be there, right? Like you're already treating them like, I want to know more about you. I want to know more about what troubles are you having? And let me see if I could help you. So if you have pain, and you've been suffering with pain for a long time, pain is, drives you crazy, whether, pain, you can have physical pain and then, then have emotional pain because of how painful your physical pain is, right? You can have a lot of emotional shit going on, and that will then, manifest itself into physical pain. So it's not like you're necessarily treating one or the other, but if you treat that person, like a person and not a patient, and you're talking to them from that level of caring and compassion and empathy of saying, okay, well, I only have, you only have a certain amount of time with some people, right? So, but in the time that I'm with you, like, what can I do to improve your life? What can I do to improve your pain? What can I do to improve what you cannot do but want to be able to do? Then you are already affecting them emotionally, because if you can just reduce their pain by 10, 15, 20%, and you're able to reduce their pain and they're able to move better, how much are you uplifting their spirit? So, I mean, you can't, quote unquote depression, you can't like cure them of that, but because sometimes depending on the place where they're at, there's a lot more going on. But if you can just brighten their day a little bit, and you can help them reduce their pain so they could sleep better, or help them to learn to position themselves better so they could sleep better, or if you are helping them during the day so they could just move better, so they have less pain, so when they do go lay down they have less pain, they could sleep better. Those are all areas of how you could help someone from the emotional side when they have arthritis, and even when it's really when they have severe arthritis, just, listening, you know?
Mm-hmm. Yeah, I think those people that have that severe arthritis,
Yeah.
I mean, I've seen it over the years. It's just
Really?
it's so debilitating in like you said, physically and emotionally. And then and they just feel like they can't do anything. And so it's really important to like focus on the occupations, like you said, that are meaningful to them. And if you can adapt or, teach them techniques or range of motion or strengthen or whatever you need to do, looking at them from a holistic perspective and help them participate, gosh,
yeah,
I mean, that's our goal anyway,
we
right?
do.
Like that's what we do.
It's
But
hard. You do, or you can lose sight of, what you do when you're doing it all the time. Hey, listen,
yes.
I did. I can tell you when I came out and was doing skilled nursing or inpatient rehab, because I thought maybe, because sometimes it takes you a little while to learn how to be a good therapist. This is what I always say. It always takes a few years to kind of get your feet wet and get accustomed to your profession, right? And I always say it takes like a good 2 to 4 years to kind of come into your own, learn to be a better therapist. And when you are, then you can serve your patients that much better. And when you work in an environment in which you enjoy, sometimes I hear everyone wants to do hands, but I'm like, you can do hands anywhere. You can do hands on any patient. People are like, but I want to do hands. Like they only see hands as being an outpatient job. And I don't think that. I've been doing hands since I came out of school. And I can say that I did hands when I was in the skilled nursing facility, when I was in acute. Oh my God. In acute care, you do a lot of hand therapy, because the people there, even when they get pneumonia, okay, and they've been laying in bed for a week and they can't move, when they get up, they can barely brush their teeth or wash their face. Like they really can't move their arms without like running out of breath, right? So, as a therapist, you can get that kind of experience, and you could just, slowly learn over time. You just can't, be, think that you're just going to be the specialist, like as soon as you graduate and you took a class, and I think people are lured by the fact that, these tendons or these fractures, and it's not necessarily all it's cracked up to be. I think that when you, really enjoy helping people, it doesn't matter what setting you're in, you'll be able to take away like, the positivity and like how you're helping people. So, I mean, I know that it's taken me like almost 19 years. Like I can only say those things because shit, I'm old, girl. But I can clearly tell you that I didn't say or think the way I think now when I was 2 to 3 years out of school. You know what I'm saying? So we can say that now that we're old, because I used to look, it's different, right?
Yeah.
It's different. Like I used to look at those therapists and be like, oh man, either I want to be like you or whatever. But to be like them, you got to get old. You got to say like, shit, I don't got 20 years of experience now. And, so don't try to move too fast, people. Don't try to move too fast.
No, but you can gain so much experience in so many different areas. I don't think people, like you said, realize that. I mean, I did outpatient acute care and inpatient in one facility and just kind of rotated. And like, I've never worked in a quote hand therapy clinic, but I feel like I have a pretty good understanding. I'm no expert, but I have a pretty good understanding of what,
an expert
after
in the
this many
areas
years,
that
you know what I mean?
Because you do hands.
Yeah.
You just do it hands for maybe like an older patient population. You know what I mean? Like you do hands. I always say that if they're lucky, they got 2 arms, 2 hands, you could be working on them.
You can be working on it. Well, let's talk a little bit about, see, I met you
We did,
basically, I
Mandy.
think, through
I
social
know.
media,
We did meet through social media. We met through one of those OT groups a couple of years back.
Yeah.
And so, yeah, that was really cool. Just kind of getting out there. I think it was when I was starting to go out on my own and starting to look for a community, basically.
Yeah. But now you're starting a CHT Secrets Instagram. I love following you. I love following you on Instagram. Well,
Thank
have
you.
so many fun videos, first of all. And it just looks like your work environment
well, you'd have to
is
ask
fun.
my
Like, you
therapist.
have a
I'm
fun
yelling
crowd.
a lot. I just sound fun when I'm talking to strangers, No.
I know how it is. No, but talk a little bit about what CHT Secrets is kind of all about. And
Yes,
I
thank you so
want to
much.
invite everyone to check it out. But talk about it a little bit.
My original page is hands-on therapy services, and that's really geared towards, speaking to the people that we want to serve. And I just noticed a few years back that, I have a lot of therapists that follow me, and I get therapists that reach out to me all the time, whether it be locally, whether it be on LinkedIn or Instagram, because they want to know more about how to become a certified hand therapist, or they want to know, I just graduated from school, how do I get into hand therapy? Those kind of things, those kind of career types of advice. And honestly, when I first started my company, I had a lot, if I responded to you, thank you for asking, but I used to respond to people, and I still do, but I don't really have as much time to give to each individual person that asks me, and these long posts and these long answers, Instagram page. So if you are a therapist and you are looking to learn more about what to do with hand or arm types of injuries, no matter what setting you're in, and you just want to be a part of this community where you want to learn more about upper extremity management, then I invite you to follow me on CHT Secrets. I hope to have more and more things out in the future because I'm trying to be like Mandy. I might not have a podcast, but I'm really active on my YouTube page and all that stuff for my clinical practice. And so, I'm going to eventually do something where I'm offering different classes. And right now I'm just providing a lot of free information on there. So different things, different topics come up. I'll answer different questions. And so it's for a variety of people who just want to learn more about, upper extremity management. So I definitely invite you to follow me on Instagram. For right now, it's CHT Secrets, and more to come soon.
More to come.
CHT
Secrets on Instagram.
Yeah.
It's fun. I love following OTs on Instagram. There's more and more out there, but
there is.
People have such good ideas, and it's fun to hear, learn about other people's experiences and what they're kind of working on. And I love the OT entrepreneur, you know what I mean? Stuff like that.
I've met so many people. We met online we met through Facebook, but I've met other therapists from across the country, around the world,
I know,
that have referred patients to me, or we've just chatted on Instagram, just back and forth stuff. And so, Instagram's a little bit easy, just to kind of go back with a few sentences here and there. But, a lot of times when it comes to career advice, or, I've had people ask me about, helping them with certain things that just, they're time consuming. And right now I don't have it. So I'm kind of looking to create something where I can help those people who've reached out and asked, okay, well, I would like to get more help. And I want to provide that kind of help, but in a more organized, more helpful way that's, that adds value to their lives, and not just haphazardly, piecing some pieces together.
Right. But, perfect. Well, everyone, check it out. CHT Secrets on Instagram, and more to come from. And Thanks everybody for listening, and thanks for being a guest today.
Thank you, Mandy.
All right. Thanks everyone. Thanks everyone for listening.
Do you feel like you're navigating the OT world without a map? Not feeling confident or competent in your day-to-day treatments and struggling to apply your knowledge clinically? Then be sure to check out the Seniors Flourish Learning Lab membership. It has all of the treatment ideas, patient handouts, clinical resources, community support, and mentorship